Pennell. I practice adult epileptology at Brigham and Women's Hospital in Boston, Massachusetts, affiliated with Harvard Medical School. I think a key thing is always considering that woman can call you the next day and announce that she's pregnant. So you really need to consider about the safety during any potential pregnancies, planned or unplanned, because in the United States, over 50% of pregnancies are unplanned in general. So when you're selecting a medication, you want to select one that would be safe during pregnancy for the developing baby, as well as for maintaining seizure control for that woman's type of seizures. So a neurologist who is treating a woman with epilepsy, it is a time of enhanced monitoring of that woman, but the outcomes can be very improved with that important monitoring. So you want to double check, make sure she's on folic acid, and pay very close attention to not only the type of medication she's on, but the dose. Is she on the lowest dose to keep her seizures controlled at the conception, the beginning of pregnancy, and then throughout pregnancy you will need likely to do dose adjustments in response to changes in the serum concentrations of those medications. We don't have any standardized protocol, but in general, many people working in the field do recommend monitoring the drug levels on a monthly basis. I don't like the general statement, all AEDs, all anti-epileptic drugs do the same thing. And now we know there is a difference. There's some of our medications that have a huge risk for structural teratogenicity causing birth defects. But we are fortunate now that we have information that there's other medications we can choose with a very, very low risk for birth defects, not much different than the general population. We need to also continue to think about those effects of the medication throughout the entire pregnancy, not just the first trimester, because those medications can have effect on the developing brain. And again, we're starting to get great information about which medications cause problems with neurodevelopment, with increased risk for learning disabilities, intellectual disabilities, and autism, and other medications that show a very favorable safety profile.